Are you ready to work those eye muscles? Because today we are diving deep, deep into the world of esotropia. And before you go thinking, oh yeah, crossed eyes, we get it, trust me, there's a lot more to this than, well, meets the eye.
It's wild how something that seems so straightforward, like how our eyes line up, can actually be this big medical mystery. So many things can impact it. We're talking how your eye muscles work together, genetics, even some underlying health
It's like
conditions.
a whole detective story playing out right there in our eye sockets. And speaking of mysteries, one of the things that really surprised me was just how common this condition actually is. Like, get this, it affects something like 1 to 3% of everyone here in the U.S. That means you've probably walked right past someone with esotropia and not even realized it.
Exactly, and that's why getting a handle on esotropia, what causes it, the different ways it can show up, and how it's treated is so important.
Especially because if you just ignore it, some pretty serious complications can develop. Think potential vision loss, lazy eye. Those are some high stakes. So let's break it down for everyone out there. What exactly are we talking about when we say esotropia?
At its simplest, esotropia is when one eye, or sometimes even both, turns inward towards the nose. It's the classic picture that pops into your head when you hear crossed eyes. But like we were saying before, it goes way beyond that simple definition.
And one of the things that really surprised me was how many different types of esotropia there are. It's not like a one-size-fits-all kind of thing, is it? Nope, not at all. There's infantile esotropia, which, can actually be completely normal in babies under 3 months. Then on the flip side, you've got acquired esotropia. This one shows up later in life and can be a warning sign for other health problems.
Wait, so you're telling me those adorable cross-eyed moments that parents love so much that can be totally normal?
In most cases, absolutely. As a baby's vision develops, it often sorts itself out. But if it sticks around past 3 months or you're noticing it in older babies, then yeah, you'd want to get that checked out. That's when it could be a sign of infantile esotropia.
Okay, good to know. Good to know. So we've got the totally normal in babies type, and then we've got acquired esotropia. That's where the detective work really starts to get interesting, right? Exactly. Acquired esotropia can sometimes mean there's something else going on in the body. Things like diabetes, thyroid issues, even problems with the nervous system can be linked to it. It can be a real clue.
So it might not be an eye problem on its own, but a symptom of something else entirely. Wow. And then there's sensory esotropia, and if I'm understanding this right, this type is actually caused by one eye having poor vision.
That's it. It really highlights how interconnected our vision system is. When one eye isn't seeing as well as it should, it can throw off the coordination between the two eyes, leading to that misalignment.
Okay, so we're already seeing just how complex this condition is, different types at different ages when it can show up. But what about the root causes? What actually makes esotropia happen in the first place?
Well, it's like you said, there are so many ways esotropia can show up. So nailing down just one cause, well, it's not so easy. It's usually a whole bunch of things coming together, really. But let's talk about some of the more interesting causes that came up in the research you were looking at. Some of them were pretty surprising.
Yes, some of those definitely caught me off guard.
One that really stood out to me was head trauma.
Really?
Yeah, even injuries that seem really minor can end up having this lasting effect on how well your eye muscles work together.
You definitely don't think about your eyes getting out of whack if you bump your head, but I guess it makes sense those muscles and nerves are so delicate.
Exactly. And it really drives home how important it is to get your eyes checked out after any head injury, even if it doesn't seem like a big deal at the time. Because you just never know how those things might affect you down the line.
It's like a domino effect. One little thing leads to another, and then bam, you've got esotropia. So what else is on the list of usual suspects? I know we saw genetics in there somewhere.
Oh, absolutely. Genetics is huge. In
Yeah.
fact, that article you sent over, it specifically talked about how important it is to keep a close eye on kids' vision if there's a family history of strabismus. Strabismus is basically a broader term for eye misalignment. So if you know there's already a chance of it happening, you can be extra careful, catch it early.
Makes perfect sense. And of course, we can't forget about those underlying conditions we mentioned earlier.
Right, that's a big one, and it's where things can get easily misunderstood. People might see esotropia and think eye problem, right? But sometimes it's actually a sign of something much bigger going on. Things like diabetes, thyroid disease, even issues with the nervous system. That's why working with a healthcare provider who can put all the pieces together is so, so important.
It's like that saying, the eyes are the window to the soul. But in this case, it's more like the eyes are a window to what else is going on in there. Okay, so let's say someone is diagnosed with esotropia. What are their options? I'm guessing surgery is on the table, but it's not always the first resort, is it?
You're right. Surgery is definitely a possibility, and it often works really well.
Yeah.
But it's not always the first thing doctors try. The best way to treat esotropia really depends on the person, what type they have, how bad it is, their overall health, all of that.
Okay, so besides surgery, what else is out there? I see something here about glasses. Could something that simple really help?
You'd be surprised. For some people with esotropia, glasses, or even just contact lenses can make a big difference. This is especially true for accommodative esotropia, which often goes hand in hand with farsightedness. Basically, those special lenses help refocus the eyes, and that can be enough to get things back in alignment.
Ah, okay, so we're not just talking your average drugstore readers here, right?
Right, we're talking about lenses that are specifically designed to help with this, like bifocal or prism lenses. They work by helping to realign the eyes and improve how well someone can focus.
Okay, so glasses, contacts. What about vision therapy? That sounds kind of intense.
It does sound intense, doesn't it? But it's actually pretty interesting. It's basically a series of eye exercises that are meant to strengthen the muscles in your eyes and help them work better together. It's like physical therapy, but for your eyes.
Physical therapy for your eyes. I love that. Okay, so I'm picturing a room full of adults doing eye exercises, which is kind of hilarious. But hey, if it works, right?
Exactly. And the best part is it can work for people of all ages.
Mhm.
And then there's the treatment that everyone wants to talk about, Botox.
Wait, Botox, like the same Botox that gets rid of wrinkles?
Yep, the one and only. It's not just for foreheads anymore. In this case, it's used for therapeutic purpose, to help relax certain eye muscles. And when those muscles relax, it can help to realign the eyes.
That's amazing. Botox really is the Swiss Army knife of medical treatments, isn't it?
It really is. But on a serious note, it's important to remember that Botox isn't a magic solution for everyone.
Of course, of course. Like you said before, the best treatment is going to be different for everyone.
Exactly. And that's why having a good ophthalmologist on your team is so important. They can help you understand your options and come up with the best plan for your specific needs.
Okay, so we've talked about the different types of esotropia, what causes it, how it's treated. But what's it actually like living with this every day?
Well, it really depends. Everyone's different, and the severity of their esotropia plays a big role. But some common challenges people face are things like seeing double, having trouble judging distances, and then, unfortunately, there's also the social stigma that can come with it.
Yeah, kids can be tough on anyone who looks a little different, and that can definitely have a lasting impact.
It's true. That social aspect can really take a toll on self-esteem and quality of life.
Definitely something important to keep in mind. But on a more positive note, with early intervention and the right treatment, a lot of people with esotropia can live completely normal and fulfilling lives, right?
Absolutely. That's a really important message. This isn't a life sentence. With the right support and care, people with esotropia can achieve anything they set their minds to.
I love that. Well, before we wrap up our deep dive into esotropia, anything else you want to leave our listeners with?
You know, there's something that's been kind of bugging me as we've been talking. Earlier, you mentioned how esotropia is more common in white people than black people.
Oh, right. That was a pretty interesting detail from one of the articles.
It is interesting, but it's also kind of a medical head scratcher, don't you think? Why would there be a difference at all?
That's a really good question. Could it be genetics? Or maybe something in the environment? Access to healthcare? Or maybe like a combination of all of those things?
Exactly. It's a complicated issue, and researchers are still trying to figure it out, but it just goes to show how much we still have to learn about this condition.
It's a good reminder that we don't have all the answers, even when we think we do, which is part of what makes science so fascinating.
I totally agree. It's all about always asking why and digging a little deeper, even or maybe especially when the answers aren't easy to find.
Asking why, that's a great takeaway for our listeners. So to sum it all up, if you're listening to this and thinking, wow, esotropia is way more complex than I realized, you're absolutely right. But it's also important to remember that you're not alone. Esotropia is a common condition, and with the right information and the right care, it's definitely manageable. And for those of you out there who love a good mystery well, that question about why there's a racial disparity in esotropia is still unanswered. Maybe one of you will be the one to crack the code. Until next time, keep those eyes open and those minds curious.